Narcissistic personality disorder. Narcissistic personality disorder (NPD) is a mental health condition characterized by a long-term pattern of exaggerated self-importance, a need for excessive attention and admiration, and a lack of empathy for others. People with NPD often have a sense of entitlement, believe they are special, and may exploit others to achieve their goals. It can impact their relationships and functioning in various areas of life. Treatment, such as therapy, can help manage NPD symptoms, but it can be challenging because individuals with NPD may resist acknowledging their issues. If you or someone you know is struggling with NPD, it's important to seek professional help. To avoid engaging with individuals who may have narcissistic personality disorder, NPD, or narcissistic traits, consider these strategies. 1. Set boundaries. Establish clear personal boundaries and stick to them. Narcissists may push boundaries, so it's essential to be firm and consistent. Number 2. Recognize red flags. Be aware of signs of narcissistic behavior, such as a constant need for admiration, lack of empathy, and manipulation. Trust your instincts if something doesn't feel right. Number 3. Limit personal information. Be cautious about sharing personal information and vulnerabilities too quickly. Narcissists may exploit this information to manipulate or control you. Number 4. Avoid feeding their ego. Don't overly praise or cater to their ego. Narcissists thrive on admiration, and excessive flattery can encourage their behavior. Number 5. Maintain independence. Keep a sense of independence and self-worth. Narcissists may try to make you dependent on them for validation or support. Number 6. Practice active listening. When engaging with them, listen actively and calmly express your thoughts and feelings. Avoid confrontations or power struggles. Number 7. Limit contact. If dealing with a narcissistic person becomes harmful or emotionally draining, consider limiting or cutting off contact, if possible. Number 8. Seek support. Talk to friends, family, or a therapist about your interactions with narcissistic individuals. They can provide perspective and emotional support. Number 9. Educate yourself. Learn more about narcissism and NPD to better understand their behavior and how to protect yourself. Remember that it's often challenging to change a narcissist's behavior, and your primary focus should be on protecting your well-being and mental health. If you believe you are in a harmful or abusive relationship with a narcissistic person, consider seeking professional help or counseling for guidance on how to navigate the situation safely. A person with narcissistic personality disorder, NPD, may display the following characteristics. 1. Grandiosity. They have an exaggerated sense of self-importance and often believe they are special or unique. 2. Need for admiration. They constantly seek admiration and validation from others and have a strong sense of entitlement. 3. Lack of empathy. They struggle to understand or care about the feelings and needs of others, often appearing indifferent or dismissive of others' emotions. 4. Manipulative behavior. They can be manipulative in their interactions, using others to meet their own needs and disregarding the well-being of others. 5. Fragile self-esteem. Underneath their grandiose exterior, they often have a fragile self-esteem that is easily wounded, leading to outbursts of anger or frustration when criticized or challenged. 6. Envy and belief in being special. They may harbor envy toward others and believe that only people who are equally special or high status should associate with them. It's important to note that a diagnosis of NPD should be made by a qualified mental health professional, as it requires a comprehensive assessment of an individual's behavior and psychological history. These traits may vary in intensity from person to person with NPD, and not everyone with narcissistic traits will meet the diagnostic criteria for the disorder.